Fidane, good morning, everyone. My name is Nava Koram, and I am the Legislative Aide for the Committee on Health and Welfare. It's my pleasure to welcome you all today on behalf of the committee to the legislature's first CNMI Pride Talks. We'd like to thank you all for being here today, especially our LGBTQ+ advocates, whose bravery and determination to make our island safer does not go unnoticed. There's a nice echo in the back. Your vulnerability in being your authentic selves sets a great example for our children and youth to be proud of who they are. LGBTQ+ individuals are an integral part of our community, and yet they do not have access to the same resources as everyone else. They often face discrimination in healthcare, the workforce, and educational settings. Bullying against LGBTQ+ youth is far too frequent and has resulted in children missing school and attempting to take their own lives. A 2019 PSS survey found that the rate of attempted suicides among LGB youth is more than double that of their heterosexual peers. These numbers are hard to stomach, but are essential to address in order to move forward and create an environment that is mentally, emotionally, and physically safe for everyone. The CNMI also ranks among the lowest in the nation for protective policies for the LGBTQ+ community, a 2.5 on a 38.5 scale, and we must do better. It is our hope that today will be the start of many conversations between the legislature and the LGBTQ+ community, so that we may address their needs and work together to ensure a more equitable future. Our program today will start with public comments, and we'd like to ask anyone sharing public comments to please sit in the middle. Public comments will be limited to 5 minutes, but depending on how many people would like to speak, that time may be extended. We will then take a short break and we'll bring some refreshments out in the back. And during the last hour of our program, we'll hear from advocates from the LGBTQ+ community. Tyra Lynn Sablon, founder of Tea Project, Tiara Evangelista from the Community Guidance Center, Kiki Igatol Benjamin and Cheyenne Mendiola from the Coalition Against Domestic and Sexual Violence, and Dr. Jennifer Meritita, who will be speaking in her capacity both as founder of Pride Mariana's Youth and mental health specialist for PSS. Their testimony will be followed by time for discussion and questions with the committee members, and I'll be helping to facilitate that. Written testimony will also be accepted and can be sent by email to Tina Sablon at rep.sablonc@cnmileg.net. We'd like to remind everyone that today our goal is to foster a respectful and safe atmosphere. Before we begin, I'm going to hand it over to Chair Tina Sablon to introduce the members of the committee.
Good morning. Thank you, Nava, for being our gracious MC and facilitator for today's first CNMI Pride Talks here at the legislature. My name is Tina Sablon. I chair the Health and Welfare Committee. Happy Pride Month, and welcome to all of our roundtable speakers today and all the members of the public, our advocates who are here and who will be providing testimony. And I'm just so grateful for this gathering and for the beginning of this conversation. So without further ado, I'd like to introduce the members who are here. Beginning with my right, our Vice Speaker and Health and Welfare Member, Representative BJ Attel, the Vice Chair of the Health and Welfare Committee to my left, Representative Layla Staffler, our Speaker of the House, Edmund Villagomez. Thank you for joining us today, Mr. Speaker. And Representative Sheila Babalta, Representative Donald Manglonia, both members of the Health and Welfare Committee. I'd also like to introduce our Legislative Assistant, Claire Sablon from the Legislative Bureau. And supporting this proceeding today, this roundtable today as well, is our Sergeant at Arms, Pete Tawai, who will be guiding members of the community who will be participating in the public comments portion of this program. And of course, John Diaz, who is our IT guy, making today's roundtable available online at the CNMI Legislature's Facebook page and also on channel 23. So thank you. Back to you, Nava.
Thank you, Chair Sablon. Sarge, if there are any public comments, would you please escort them up? Thank you. Would anybody like to share public comments? Okay, if we do not have anyone that would like to share, then we will just move on to our invited guests. So if it is okay, Ms. Sablon, we'll start with your testimony.
Do we have to push it down? No, just leave it. You're good. Okay, so good morning. And first and foremost, thank you. Thank you for this historic opportunity to finally be able to sit here and talk with our leaders in the community about some of the disparities that have affected lesbian, bisexual, gay, transgender, and non-conforming people here in the CNMI. According to the Movement Advancement Project of the 5 territories in the United States, CNMI ranks one of the lowest, especially when it comes to LGBTQ youth laws and accurate identity document, and also with healthcare. So the 4 categories that I would like to highlight today is non-discrimination laws, healthcare, accurate identity documents, and LGBTQ youth laws and policies. So we'll start with the first one, sex discrimination and how it affects employment, public accommodation, and healthcare. Discrimination can occur on a basis of sex, sexual orientation, and gender identity. Each of these factors alone can serve as a basis for discrimination, and each is a form of sex discrimination. Individuals who are LGBTQ or are perceived to be LGBTQ have been subjected to history and pattern of persistent, widespread, and pervasive discrimination on the basis of sexual orientation and gender identity by both private sector, federal, state, and local government actors. Just like anyone else, transgender people need preventative care to stay healthy, and acute care when they become sick. They also need medical care to treat gender dysphoria. Gender dysphoria, transgender people's healthcare is both widely stigmatized and misunderstood. Those unfamiliar with health needs of transgender people might portray transition-related care as cosmetic or a choice. The fact is that medical necessity of transition-related care is overwhelmingly recognized by medical experts. Despite the protections of the Affordable Care Act and other laws that prohibit discrimination, transgender people continue to encounter barriers to care. Transgender people face significant job loss, job fragility, and therefore a higher rate of uninsurance. While the majority of public and private insurance plans have removed exclusions that blatantly target transgender people, many plans continue to deny coverage for medically necessary care. So what this means is, let's say I was to go to the hospital and I wanted to address my gender dysphoria. A couple years ago, I would have been denied. Or a few years ago, I would have been denied. But because of the Affordable Care Act, it has allowed us to be able to get some of the help that we need. When it comes to things like gender affirming surgeries, what we have to do as patients is kind of like play around with the billing codes, and not everybody knows how to do that. And not everybody is very savvy at doing that. And so a lot of the times, some of these cares that are needed for transgender people, they're denied, flat out denied. And a lot of them are just left. just like that. And so the absence, according to the National Transgender Discrimination Survey, 48% of transgender folks postpone medical care due to systemic discrimination. That means whether they're sick, they have acute problems, they just don't go because they feel that healthcare is not focused on them, or they have to teach their doctors about what being transgender is, or sometimes they don't even feel comfortable because they're harassed with their names, and we'll go over the name part a little bit later, but yeah. And so the absence of explicit prohibitions of discrimination on the basis of sexual orientation and gender identity has caused unnecessary hardships for LGBTQ plus individuals, especially in accessing healthcare. Number 2 is documents and identification. Transgender people need accurate and consistent IDs to open bank accounts, start new jobs, enroll in school, and travel. However, the name and gender change process is complicated, and proof of surgery or court orders that have made it sometimes impossible for trans people to update their IDs. As a result, according to the National Transgender Discrimination Survey, 22% were denied equal treatment by government officials and agencies. 41% live with ID that matches with their without ID that matches their gender identity, and the CNMI numbers are higher than that. So, what happened? Like, if I were to go and get, if I wanted to, I'm done with my transition. Obviously, my gender expression is female. If I wanted to go get my name changed and my ID changed here in the CNMI in comparison to places like Hawaii. In Hawaii, I can just go to the driver's license with my court order. Okay, I want to change it, do all the procedures that, and be able to self-select my gender on my driver's license and my birth certificate. Here in the CNMI, you're having to go through, you have to go to vital statistics. When you get to vital statistics, they put you back. You got to go to the hospital to get your doctor certification of sexual reassignment surgery. And that's fine and everything, but I just want to point out that not all transgender women or men want to get the surgery. And therefore, I think it's important that we recognize that one of the major barriers for acquiring identification is Public Law 1550, requiring a doctor certification of gender-affirming surgery to be able to change gender marker on birth certificate or identification. Not all transgender people want to get that surgery. Currently, obtaining federal level identification, such as a passport, does not require doctor certification or even a court order to change that gender marker. Furthermore, courts require for name changes to be published. Right now, the state of New York has made progress allowing courts that authority to waive the requirement to publish records and to be able to seal them also, due to the large numbers of people being harassed with dead names. So dead names is what in the transgender community we call our birth name that we don't use anymore. So what happens a lot of the time with transgender people is, let's say we want to bully somebody, right? We dig up their past, we dig up documents and records. And right now, it's so easy to look up those kind of things. We bring them up, we set up a campaign online to bully them with that dead name. And so a lot of the times, that's what's been happening. And it's destroyed a lot of lives. Okay. So number 3, mental health for the youth. The American Academy of Pediatrics recommends healthcare providers have teen-friendly and welcoming offices for sexual minority youth and obtain comprehensive, confidential, developmentally appropriate adolescent psychosocial histories to determine their strengths as well as their risks for diseases. Referrals for mental health or substance abuse may be needed. Sexual and gender minority youth who have been abused, neglected, or bullied because of their sexual orientation or gender identity have higher rates of depression, have thoughts of and/or have attempted suicide. Lack of acceptance, understanding, and abuse at home often leads to youth homelessness. Family rejection during adolescence is associated with mental health and substance abuse problems. The rates for physical, sexual, and emotional abuse and bullying of LGBT youth and questioning are consistently higher than that of heterosexual youth. They are more likely to skip school because they feel unsafe on their way to and from school. So according to the 2019 NMI Youth Risk Behavior Survey, thank you, 18% of LGB youth versus 3.9% were threatened or injured with weapon on school property. 21.6 versus 8.3% were forced to have intercourse, sexual intercourse, when they didn't want to. And the packets that I passed around, the YRB is right in the back, so everybody can go along with that. 28.8% versus 9.5% experienced sexual violence by anyone. These are high school and middle school kids. 44.8% versus 25.7% have seriously considered attempting suicide. 40.4% versus 15% actually attempted suicide. 43.6% abuse prescription medicine, and an average of 21.9% versus only 2% use hard drugs. These are LGB youth. These numbers are alarming, and certain factors can protect youth from engaging in behavior that lead to poor health outcomes and play an important mediating role in the development and life course of our youth. Protective factors include family support, acceptance, the presence of caring adults, positive peer influences, strong self-esteem, and participation in school activities. Counseling for minors range in getting support from a caring adult to receive mental health treatment from a mental health professional. School-based behavioral health specialist, private practice psychotherapist, primary care, or a combination of any of the listed above. Considerations when counseling youth on issues of sexual orientation, sexual expression, and gender identity are: youth need supportive, thoughtful adult to be sounding board, to talk about their struggles. LGBT and questioning youth may need mental health treatment from an LGBT affirming counselor for depression, anxiety, substance abuse, and/or mental health disorders. Again, we have the numbers to show it, and what we really need is the mental health professional counseling allows for therapeutic interactions to ameliorate mental health disorders or change problematic behaviors brought on from stress and trauma that the youth has experienced. Not all sexual or gender nonconforming minority and questioning youth need mental health treatment, but may need support from a caring adult. One of the major barriers for LGBT and questioning youth accessing mental health or substance abuse counseling in the CNMI is the need for parental consent. Youth do not have monies for mental health or substance counseling and/or for fear of repercussions from their parents or guardians for receiving services. And the stigma of mental illness and anti-LGBT sentiments from inside and outside of mental health and substance abused health systems can be prohibited. So what this means is from somebody who grew up LGBT, I can't speak for everybody in the community, but for me and a lot of my peers, it would have been life-saving, and it would have helped us um, avoid so much trauma if we were able to seek out help without our parents knowing, and just be able to talk to a counselor, a therapist about drugs, about our sexuality. Sometimes we don't even know it's our sexuality. Sometimes we just may be acting up. You know, when you're a kid, you have a lot of hormones going through you. You have a lot of emotions. You don't know these kind of things. And just having a professional there to kind of like help you sort your thoughts and your feelings can be a lot life-saving. Imagine how many kids would be alive today if we had that. Thank you. So, my closing remark. Despite all these stressors, we, the LGBT people, have found ways to survive, thrive, and be successful. We who are here today, hi guys. We who are here today and everyone else who is watching at home are all testaments to the resilience found in each of us. We have to reclaim a positive sense of identity. We have to promote pride in our community. We must empower each other and love one another. To our youth, we see you, we hear you, and we love you. So I leave you with part of a poem from Maya Angelou. Did you want to see us broken, bowed head and lowered eyes? Shoulders falling like teardrops, weakened by your soulful cries. You may shoot us with your words, you may cut us with your eyes, you may kill us with your hatefulness, but still like air I'll rise. We are the hope and dreams of all of those LGBT people who have died to get us to where we are today. And so we rise, we rise, we rise. Okay. Thank you.
Thank you very much, Ms. Sablon, for your testimony. If it's okay with everyone, we'll move on to one of our next guests and have everyone speak before we move on to the discussion portion of our program. So, Ms. Benjamin, would you be able to share your testimony now?
Yes, I may start. Hafide Zintero, Chair, Vice Chair, and members of the Health and Welfare Committee partners. My name is Kiki Gatol Benjamin. I am the Associate Director at the Northern Marianas Coalition Against Domestic and Sexual Violence, a nonprofit organization with a mission to promote, nourish, and sustain a collective movement to end violence in the CNMI. For nearly 15 years, we have worked to address the issues of domestic violence, sexual violence, stalking, and teen dating violence within our community. We work on developing and advancing policies and provide training and technical assistance to service providers to enhance programs, increase coordination, and improve service response to victim survivors. We provide community education and lead all awareness campaigns on these issues to change belief systems, behaviors, and attitudes that perpetuate violence, to include empowering victims and survivors to seek help and healing as we support victims and survivors by making sure that their voices are being heard and considered in all spaces where it matters. We all know that domestic violence, sexual violence, stalking, and even teen dating violence that happens in this community is vastly underreported. While we have made progress over the years with a more survivor-centered policies, including work protections and an emphasis on trauma-informed services, there are still barriers that prevent victims and survivors from seeking help. And there are even more barriers to reporting when you're a victim or survivor who identifies as lesbian, gay, bisexual, transgender, queer, or anywhere on the spectrum that is not straight or cisgender. Barriers to addressing LGBT intimate partner violence, both for service providers and survivors, include the belief that domestic violence does not occur in LGBTQ plus relationships and is often classified as a gender-based issue or reported as something other than domestic violence. Other barriers include societal anti-LGBTQ bias, homophobia, biphobia, and transphobia. And as we all know, society's long history of entrenched racism, sexism, homophobia, and transphobia prevents LGBT victims from seeking help from the police, medical, legal, and court systems for fear of discrimination or bias, whether it's implicit or explicit. Lack of appropriate training for service providers that are LGBTQ specific, a climate of fear that airing of the problems among the LGBTQ population will take away from progress toward equality or either fuel anti-LGBTQ bias. As we all know, nationally, domestic violence shelters are typically female only. Thus, transgender people may not be allowed entrance into shelters due to their gender or their genital. And so here in the CNMI, we have a women's shelter, which is Guma Esperanza. From what I'm aware of, they do provide services on a case-by-case basis, but it is a women's shelter. According to the National Intimate Partner and Sexual Violence Survey done by the Centers for Disease Control, people who identify as lesbian, gay, and bisexual experience domestic violence, rape, other forms of sexual violence, physical violence, and stalking by an intimate partner at higher rates than straight people and have a harder time accessing support. The CDC found that 44% of lesbians and 61% of bisexual women experience rape, physical violence, or stalking by an intimate partner, compared to 35% of straight women, while 26% of gay men and 37% of bisexual men experience rape, physical violence, or stalking by an intimate partner, compared to 29% of straight men. These numbers are too high no matter how you identify, but it is remarkably higher for LGBTQ plus people, including the 47% of transgender people who will be sexually assaulted at some point in their lifetime. Despite these higher numbers in the CNMI, we do not see a lot of reports of violence or discrimination by LGBTQ plus people. You know, when you see high reports of sexual violence or domestic violence at a given time, that is not always a bad thing. It can often mean that people are finally feeling safe enough or empowered to report and seek the help that they need. So how do we make this community safe enough where LGBTQ plus youth and adults and Manomku can say that they are a victim or survivor and can report violence and discrimination to start seeking the help and healing that they need? We must actively break down the barriers, demand more inclusive policies at work, at school, whether it be private or public, community spaces as well. We must increase our understanding of the realities and challenges that our LGBTQ community experiences. We must learn how we can be an ally with the T Project, PMY, Pride Moranis, and other organizations that are out there and being a voice for the LGBTQ community. We also need to call out and shut down those homophobic jokes, no matter who the person is who is saying it. And for us at the Coalition, we are realizing how direct services for victims and survivors in the CNMI need to not only include trauma-informed care, but also services that are more inclusive and LGBTQ friendly. We believe that in order for homophobia and heterosexism to end, we must fight all forms of oppression, including racism, sexism, ageism, classism, ableism, and all the other social isms. As for services currently available in the CNMI, you can call 911 if you need emergency assistance. We currently have one 24-hour victim hotline operated by the Care Social Services at 234-5100. Anyone can call at any time to speak to an advocate on how to report, to ask about services for victims and survivors, referral, or if you just want to talk. CARE Social Services also runs various programs to help with housing, food, and also operates the CNMI's only women's shelter called the Guma Esperanza. At the Office of the Attorney General, they have advocates to their Victim Witness Advocacy Unit who assist with temporary restraining orders and are also available to provide support and assistance. We also recommend contacting other folks and programs we are honored to be here with, PMY, PSS, T Project, and the Community Guidance Center. In closing, there is nothing wrong with being lesbian, gay, bisexual, transgender, queer, questioning, etc. We love and appreciate who you are. There is also nothing wrong with being a victim or survivor. We love and accept who you are. We remain committed as a strong ally for our LGBTQ plus community and youth as we forge ahead to creating safe spaces and promoting diversity, inclusion, and equality for all. This is Masi 00a.m, and thank you for having us here today. Happy Pride Month.
Thank you very much, Ms. Benjamin. If we could move on to Ms. Evangelista, and then we will close with Dr. Mertida.
Hafa days and tiro, everyone. Good morning. Thank you for the opportunity to come and represent on behalf of our director of the Community Guidance Center, Mrs. Reina Saris. I apologize, I didn't prepare a statement or anything. I was just informed to share the services that we do provide at the Community Guidance Center, which is the state behavioral health system under the Commonwealth Health Center. At the CGC, our services, we welcome everyone. We do recognize the need to increase our capacity in obtaining training and being better versed and inclusive of the LGBT community. Although we may not actively recognize that we are inclusive of the LGBT community, culture, subpopulation, I'm sorry, we do recognize the need we are working towards obtaining training from Pride Marianas and PMY. One of our programs, GLS, is actively involved in Pride Month. Miss Ana Ada, I did ask her to come with me. She's busy though. There's so many things that they are going through, seeing consumers, clients. So that is what we are actively doing with all the funding that's coming in from one of our federal grantor agencies, the Substance Abuse and Mental Health Services Administration. We are putting a strong emphasis on obtaining that and being an ally with the LGBTQ community. So that is what I have to share. With all the data that's being shared, we have under the Healthy Transitions Program, it is the mental health and substance use behavioral health service for youth and young adults ages 16 to 25. It is fairly new since it has been established. We are an expansion of the System of Care program, which is the Children Mental Health Services. So with Healthy Transitions, it is an expansion of that program. We are seeing an increase of referrals, but with those in the population who are at higher risk. We've worked with Dialog Academy and are working closely with JLS to target and to accept referrals from the LGBTQ. Anyone is welcome to come in, self-referrals, even through support services. That's one of the interventions that we do is the wraparound care coordination. So it's really a replica of System of Care. We do have 3 wraparound coordinators who are working with other support agencies like OVR, NMC, and I'm sorry, NMC, and also those types of support services to help the youth and young adults who are seeking services for substance use and mental health services. So yeah, we look forward to working closely with Pride Mariana's youth and Pride Mariana's and Dr. Jen, the PSS system as well. So thank you very much for the opportunity. Any questions about our services? I'm here to offer those answers.
Thank you so much, Ms. Evangelista. Dr. Maratita, if you would like to go ahead. And Dr. Maratita will be speaking in her capacity both as founder of Pride Mariana's Youth and as a mental health specialist for PSS.
All right. Thank you for giving us the opportunity to speak with you and creating this space for Pride Talks this month on the legislative agenda. My name is Dr. Jennifer Maratita. My pronouns are she, her. I'm a licensed mental health counselor serving the CNMI for over 15 years. I founded Pride Mariana's Youth, or otherwise known as PMY, a grassroots cause, alongside a group of volunteers of family and friends. We're not even a nonprofit. Our mission is to raise awareness for more inclusive, braver, and safer spaces for our community. I'm also clinical services supervisor with PSS mental health team under student support services this past year and a half. My supervisors are away for a Pride unveiling in Tinian. I apologize for not being here. I've had the privilege of providing counseling services and have been close friends, family members of people who identify as LGBTQIA. And with my son's permission, my husband and I are parents of a child in the spectrum who identifies as a transgender youth, along with his siblings who identify as allies. PMY is just 3 years old. Aligned with a family tradition, I want to share a story of one of our CNMI-born children and his mother's journey. His mother's journey to navigate his future as the first child diagnosed as a transgender youth at CHC in the pediatric ward, at least in the past decade. A very fiery little child was assigned female at birth. But from the moment he could speak, he would say no to pink, no to dolls, and identified as a superhero. At 4 in his graduation, his wish when he grew up would be to be Superman. In 2019, this child's mother and father met with a doctor who confirmed something they had suspected for a few years. The doctor stated that their child identified as transgender child, a boy, and not what he was assigned as female at birth. A little 5-year-old had a smile ear to ear and told his parents, "See, I told you." And his mother, with a big smile, said, "Yes, my little one, you were very brave, telling us all along, even though it took us a few years to listen." His mother also asked the doctor, "Please give my email, my number to any of the other parents." And there was a moment of silence, and the doctor said, "There aren't any." That your child was the first, as far as she knew. And what parents were given resources to California. That these mental health assessments and counseling support services would be paid out of pocket, and that we were told that none of these specialty services existed in the CNMI. Even colleagues in Guam didn't have those resources, such as psychological assessments, family counseling, and supports. I'll get back to that story. We know that the CNMI has a population of approximately 57,000 people. According to statistics for Development Division, 3 to 5% of roughly people identify as lesbian, gay, or bisexual, which is estimated in the CNMI 2,850 people who identify as LGB. For those who identify as transgender, based on studies, an estimated 0.6 to 1% of the population, or somewhere between 340 to 570 individuals in the CNMI identify as transgender. According to the US statistics, According to the CNMI Youth Behavioral Survey, an anonymous survey given by the CDC every 2 years in the CNMI, according to 2019, as my colleagues shared, the LGBT students represent 13.2% of the PSS student population surveyed, quite higher than the US statistics. There's also a population of kids who rated not sure as an estimated 7% on these surveys. In a PSS population of an estimated 10,000 students, that would mean an estimated 1,320 of our kids identify in the spectrum. And that survey has not been updated to ask for those who identify as transgender, non-binary, or other expressions or identities. When we're talking about our youth who identify in the Pride community, we're not just talking about sexuality. The term sexual orientation is loosely defined as a person's pattern of romantic or sexual attraction or lack thereof. We're talking about also a gender identity, a person's deeply felt inner sense of their own gender, including being male, female, or somewhere else in between. There's also a term called gender expression, and it refers to characteristics or behaviors such as appearance, dress, mannerisms, speech patterns, each of which could be described as masculine, feminine, or something else. Gender identity and gender expression are each independent of sexual orientation, and transgender people may also identify as heterosexual, lesbian, gay, bisexual, queer, or something else. So a little bit of education. Like mentioned earlier, the Movement Advancement Project maps out the status of LGBT equality, discrimination, protections, and mapping various laws and policies that impact Pride people. Out of an estimated 40 laws and policies encompassing things like relationships and parent recognition as same-sex couples, state non-discrimination laws like employment or housing, meaning you can be denied employment or fired for your identity or sexual orientation, kicked out of your home. Religious exemption laws, LGBTQ youth laws and policies that include the language of LGBTQ in bullying policies, access to sports, healthcare laws and policies, criminal justice laws and policies, ability for transgender people to correct, name, and use gender markers on identity documents. An exemplar is Puerto Rico. They're not there yet. They're at 21 out of 40 of the laws and policies. Like Tyra mentioned, the CNMI is one of the lowest. We are at 3.5 for sexual orientation policy. We are -1 for gender identity tally. Negative, that means below 0. Guam is 6.7 for sexual orientation policy, but don't worry, they're also in the negative for gender identity. Specific to our LGBTQI youth, we've seen our CNMI youth reporting on surveys, certain vulnerabilities and experiences. And in my research as a mother, I came across some hard statistics that were shared earlier. Our students don't feel safe at school. They've been verbally, physically, sexually harassed, or even assaulted. Some of our youth report this is part of their everyday life. We had our Pride Walk last week, a very nice demonstration. But after that, some of our kids were harassed, social media. Despite our efforts, we live in a community where over 60% of our youth live in exclusion and feel sad and hopeless, and that 1 in 4 will have made an attempt to end their life this past year. As adults, this increases to 40%. Some of these kids are not feeling that resources exist, or parents who don't know how to access resources or services. I know this because I'm one of those parents. These issues are only the tip of the iceberg and some of the challenges faced by our youth. And the trend data is showing that these are increases over the past 6 years. So in discussions of our youth, we're up against disproportionate rates of mental health, sexual, physical violence, bullying compared to their peers. As a clinician, when you see risk factors, you look for those protective factors. We want to lift those up. Research from the Trevor Project suggests a few things like increasing safe allies in a child's life, like teachers, professors, family members, friends, coworkers who identify in the community, having access to pride-affirming churches and religious organizations, seeing YouTube and influencers, bloggers, people on TikTok, and other social media users, symbols of support such as pride flags, rainbow crosswalk, and supportive communities, and laws that support the LGBT community. That's where we need you. Back to the story I shared earlier. So what did a mother with a psychology background do? She researched. She gathered social supports. She joined off-island support groups. And in 2019, this little mama bear found out when there were no youth activities for our Pride Week, she bought some flags. And along with colleagues from CGC and the coalition, we had our first Youth Pride Walk, a parade funded by family and friends, a few business sponsors, and had amazing showing. We knew that we had to brand allyship and continue to blaze trails, an umbrella for protection for our kids. And suddenly this mother bear found herself making TikTok videos and rallying up some volunteers to carve out a space for brave voices to move past complacency and give light to the needs of our youth. The vision is trending, the college kids are in, the high school kids are in, then it mentally trickles down. PDs to NMC instructors, done. Immediately after, NMC had their first Pride Club. Mark Carmel, PD for their staff and their teachers, done. Talks of a club is beginning. The Women's Association, PSS is welcoming back orientation. 2 middle schools at PSS developed an allyship club, done. Rhoda as well joined Pride Club. Since my time with PSS, the Dog Academy staff received the training. 60 NMHS staff received our first piloted 6-hour PD. And some agencies are asking for just 1 hour, but that's not enough time. At PSS, our mental health projects is to see a GSA or Gender and Sexuality Club, formerly known as a Gay Straight Club, as research has shown, is another protective factor, as missions that include anti-bullying, sharing of safe space posters in each classrooms, and offering supports. Additional PSS services can be sought through mental health at cnmipss.org. Last year, 800 participants, despite our pandemic, came out for a Pride motorcade. And this year, for the first time, we were able to celebrate Pride on all 3 islands. Over 600 came out to our Pride at the Park, 200 at our Youth Pride Walk last week, over 130 at our 5K race, PSS securing a bit of funding to support Pride clubs in the schools and curriculum. At our Strides for Pride, we honored 5 community members who had since passed, and several stories of horrific violence that was shared. What we didn't mention was the several CNMI youth in the community who have also died by suicide in the recent years. The pandemic certainly has affected all mental health systems for a demand of increased services, So were our Pride kids, who were stuck all of a sudden in non-affirming homes. I know this because I provided counseling supports during the pandemic and still do. I had kids pull me once we reopened in the hallways talking about their fears, incidences of bullying, having been kicked out of their homes and living with a friend, some not feeling safe to go to school, some not feeling safe to interact with members in the home, hateful comments on social media. Even I have to screen our Facebook account for hateful slurs. A few CHC doctors had told their kids that their identity didn't exist. I responded to crisis for depression, bullying reports, and suicide attempts for our youth this past year. They're not just numbers, they are our kids. The Human Rights Campaign has noted that this has been the worst year for introduced anti-LGBT laws introduced all over the states compared to the past decade combined. These include banning kids from playing sports or requiring proof of gender surgery reassignment. These kids just want to play sports. There are bans for access to restrooms, but as of yesterday, that might have just changed. Businesses refusing services to couples and making it illegal for parents to seek medical care for their youth, restrictions to provide sex reassignment. And this month, a teacher named Tanner Cross in the state of Virginia refused to use correct pronouns of a transgender student in his PE class, essentially outing that kid to his peers. He cited his right to free speech and his religion and his belief that the parents were abusing their child. The teacher is even suing the school for having been suspended with pay for one day. These people in the CNMI do exist. I've met several people in the PSS system who have told me they refuse any participation in any LGBT-related activities based on their religious beliefs. My message to professionals in the community, in the medical setting, and the education system, that if you find your religious beliefs impair your ability to support and save a child in a potentially life-saving conversation, then you are in the wrong field. I'm just going to say that one more time. You're in the wrong field. I have to be brave and to have courage because someone I love doesn't have his voice yet. So do so many of his peers. In a community where you respect your elders, I'm going to ask you to be strategic on how you introduce legislation. We don't want people picketing. Kids can't see that. Our elders need to be rallied and in support of, otherwise it will just take one hateful teacher and one upset parent, one homophobic slur on IG or Facebook, and this panic and fear will spread like a contagion. There are millions of dollars being poured into anti-LGBT organizations. That's what we're up against. My advice is to tread lightly, be strategic, don't rush, and gather the community. We have an opportunity to prepare for the opposition that we have seen in the US. We have to bring everyone along, educate and increase awareness. Change can be challenged for some. It was very incredibly brave for everyone here who spoke today. But what about those who are not ready? To come in a public setting in a live broadcast? How do you gather their stories and their needs? Their stories. We are just a few, And I mentioned we had a showing of over 200 people last week. Please help us. Please help our kids, whether it's through laws or funding or symbolic activities where allies can provide safe havens, symbols, murals, policies, providing specialty services off island. We're in limited capacity. As I wrap up, I will encourage you to conduct an anonymous needs assessment. This public comments is great, but remember that many fear their safety. They are compromised and may wish to communicate in a more private manner. As you heard from the speakers, we would like to see that no one may intimidate, threaten, coerce, or discriminate any individual. That includes our LGBTQIA+ individuals, and for the purpose of interfering for any right or privilege. We would like to see increased protections from discrimination, support equality and inclusion and access to services. We'd like to see greater universal and affordable healthcare protection and coverage so that members of the community can avail of life-saving protection supports. There are other opportunities to access off-island supports that can be insurance covered. Help the CNMI government establish policies so there's no confusion about language that is inclusive of the LGBTQIA community. Require annual trainings and help schools increase safety for our kids. Support anti-bullying policies specific on LGBTQI slurs and language. Assure that when kids are outed by teachers and the use of correct pronouns and names, they can't hide behind other things. Protect our kids so that no coaches or parents will exclude children who just want to play on their authentic gender team. Provide access to gender-neutral restrooms. Secure funding to provide protections for equality and access to mental health and specializations. There are just some of the mental health and social issues that our youth face, and as a whole, this group faces significant obstacles and unique challenges. We must do what we can to make a world more safer, more inclusive space for all of our people. We want to thank you for giving this opportunity to have these discussions. Thank you for making this space for some of our voices to be heard. I want to commend those who are brave enough to speak today. Our youth are not just our future, they are our present. They are our current leaders, and they need the support of their community for safe spaces for their voices to be heard. Happy Pride Month, CNMI.
Thank you, Dr. Meritita, and thank you to all our panelists for speaking. We recognize the bravery that it takes to talk about a lot of these challenges that you face as a community. This would be a good time for us to take a short 10-minute break. We'll be bringing out some refreshments in the back. Encourage everyone to just mingle and talk to each other. If anyone needs to use the restroom, you can ask our Sergeant at Arms. And we'll take about a 10 to 15-minute break and then come back for a discussion. Thank you. Before we move on to the discussion portion of our program, we're actually going to hear from Zen and Jigger from the MHS Pride Club, who have some information to share with us. So if you guys would like to come up and sit in those two empty chairs, that'd be great.
Good morning, everyone. My name is Zen Ichiro Tomakani, and I was the current president of Marianas High School's Pride Club. I come here today in representing the CNMI LGBTQIA+ community and sharing some general statements. First off, I would like to share that the lack of education in and of the LGBTQIA+ community within the youth leads to the invalidation and exclusion of lesser known identities. The following are some anonymous experiences shared by peers both in and outside of my school. One person says, being shunned or deemed as a poser because I am bisexual. Another person says, numerous people would question if my feelings were valid or if I had experience in order for me to change my preference. For instance, people would ask if I dated girls before or if I experienced dating bisexual or pansexual girls. I don't understand how this is a contributing factor in order for me to be considered lesbian. I've had these feelings for a while now, and I finally feel comfortable being addressed as a lesbian. It just makes me sad or uncomfortable when people would tell me that I'm not a lesbian because I never had an experience dating another woman. Another person says people would invalidate me and say that I needed to choose a side because being bisexual is a phase for gay people to transition to become straight or lesbian. Another person says, though I identify as cisgendered, I've seen and heard many young adults in middle or high school make fun of our transgender, non-binary, or gender fluid siblings. Another person says, I've experienced the feeling of being pushed to the point of feeling disgusted of what I was because of how a friend responded negatively to how I liked the same gender. This person was passive about it and made me feel like they didn't like the fact that I was bisexual. They made me feel ashamed of myself, that I shouldn't be a person who felt this way. I felt super ashamed of what I was and didn't want to go to school anymore. This happened in middle school. Another person says, with the CNMI Equality Act, I hoped that it can at least educate others to keep their thoughts to themselves if it isn't nice, and to teach people that ostracizing someone due to their sexual identity being different than the norm is wrong. With this act, I hope that it can create less stigma about being a member of the LGBTQ+ community and hoping more people can come out without having any fears or doubts. Lastly, another person says that they were doubted for their sexual orientation due to stereotypes and the general fake information spread about their sexuality. Another general point I'd like to bring up is that harmful behaviors and stigma often come as an effect of a lack of representation and education. Someone writes that they've experienced a struggle to find good representation in the media, and such struggle has resulted in the exposure to adult content at a young age in hopes to find people like them. Another person says, it's also hard to accept my sexuality because my parents are super religious and conservative. It's hard for them to understand that my sexuality doesn't influence me to become a horrible or unsuccessful person. Another point I'd like to bring up is that it is hard for LGBTQIA+ youth to seek counseling and guidance. As Ms. Tyra has stated, within the LGBTQIA+ youth, statistically, we can see a major difference. Someone writes, it is hard finding someone to talk to me about me being gay. I can't talk to my parents because I heard them say bad things about people in the community. I wish I had a doctor to talk to but I'm afraid for my dad to find out. It is bad enough he is very rough and sometimes abusive because I'm gay. Another point I'd like to bring across. For some LGBTQIA plus youth, safe places are hard to find outside of their homes, most especially in the school zones where they are prone to bullying and harassment. Someone writes, since we went back to face-to-face learning, I've been blatantly called slurs in my class. I've also been purposely misgendered in front of the whole class. Another person writes, I've experienced the feeling of being pushed to the point of feeling disgusted of what I was because of how a friend responded negatively to my identity. Another person writes, I always feel a little unsafe out in public being a more effeminate gay man because of the worry that someone might try to ridicule or even worse, try to hurt me physically in some sort of way. And lastly, someone writes, I don't feel like I can live my life freely in this island, as there are many people who I know who would disown me if I were to tell them that I was gay. The last point I'd like to bring across, LGBTQIA youth are often seen as targets for hate speech wherever they happen to be present here on island. Someone writes, on many occasions the F slur has been used by straight people in a derogatory way, either to me or to someone who they consider weak. Another person writes, slurs are very normalized in the community, and sometimes when we try to educate them, they don't really listen. Another person writes, the word gay has been used from people that I know when they refer to things they do not like. Another person writes, recently, someone who I'm classmates with messaged me on Messenger saying, I hope you go to hell, you F slur. Do the world a favor and kill yourself. And what's sad is that this is normal for me. And lastly, I've heard people get called the F slur for simply being feminine or masculine. I've also been outed by a friend of mine and had my emotionally abusive ex ask me if it was true. In reading these statements from my peers, both inside and outside of my school, whether they'll be under my club or not, I hope that today I was able to share their voices, and in doing so, I hope that their voices are pivotal in creating change here in the CNMI. And I hope that starts here. Thank you.
Thank you, Zen. Thank you, Zen. We will now move on to the discussion portion of our program. If you both would like to stay seated there and participate in the discussion, you're more than welcome to, or you could also move back to the gallery. So at this time, I'll welcome any members of the committee if you had any questions for our panelists, or if any of the panelists had questions for our committee members, we can just go ahead and start with that. Chair Sablon.
Thank you, Nava, and thank you to all of our panelists today for sharing your stories and your ideas with us. My first question really has to do with just wanting to better understand the resources that are available to LGBTQ plus youth right now in the Marianas. I think you all touched on that to some extent, but what I really would like to just better understand is how do young people in the CNMI navigate their way to supportive resources, whether it's in the school system or the healthcare system. And then I think the issue that you raised, Ms. Tyra, about parental consent or notification being required, like where is that required? Is that in PSS policy? Is that in CGC policy or CHCC for that matter? Or, you know, like where are those requirements being made, and how can we make access to care, and especially mental health care, more available? So maybe just start with the first part of that. Like how do young people find their way to help and support in our school system or in healthcare for that matter?
I can answer for CGC. we get a lot of referrals from the public school system. So that's how they connect to, at least for 16, 17-year-olds. And then for the adults, they pretty much, a lot of our referrals come from the courts. We don't see a lot of self-referrals, although we have made efforts to go out into the community to ensure that they're aware of the services that we do provide, and they're basically all free for CGC. There's no requirement to pay. I think the disconnect there is if they enter through CHCC, where insurance consent forms. For adults, it's, we don't need parental consent, but for those below the age of 18, we do get parental consent through referrals from our partner agencies.
So it's a CGC policy then that for young people below the age of 18, you
that we
have to
get
have
parental
parental
consent.
consent.
Yes.
Okay, and so what about so if we wanted to address that issue, right, of young people not feeling safe to self-refer, to seek help on their own, without fear of their parents finding out, like, what can we do about that?
We'd have to work with overall CHCC because we are under the organization.
Okay, so that's an
The
internal
corporation.
policy
Yes,
at
it
CHCC.
is. Yes.
Thank you. And yeah, and did anybody else want to address that? I mean, we have our high school advocates here. Like, how do you and your peers navigate the system? Like, where does a young person in PSS begin if they wanted to get help?
As of this year, from at least the people that I've gotten to work with, we weren't aware of any source that we could go to outside of our own community to find help. So what we really practiced this year, even with the pandemic where we couldn't even see each other, we were giving each other those spaces to talk. In our club specifically, there was a time where I realized that simply asking people what their problems were, or if they were to open up about anything, what they wanted to learn more about, they couldn't just give us an answer as is. And we had to resort to anonymous survey activity. And through that, we were able to find many results such as those that I shared. And at the end of every meeting that we had, where we would educate them on the many topics that we feel were left out of the light, we would have these little sessions where we'd read through these anonymous survey answers and kind of give them advice. Our advisor for the club also happens to be a counselor at Marianas High School. So with that connection, we were able to sort of give ourselves that safe space, that support system. And with the help of Ms. Tyra from T Project and Dr. Jen from Pride Marianas Youth, we were able to bring our inner circle out. And during this month of Pride was when we really discovered that our support system extends beyond what's offered at our own school. It's offered, it's there, and it's not just within us. We can also reach out. And with this roundtable, with this discussion, I hope that more opportunities and safe spaces outside of our school are more open and more familiar and warmer to them.
I'd like to add to some of the resources. So a couple years ago, PSS school counselors had received a training on how to support GSAs in the schools. When I started with PSS a year and a half ago, there was only one school that had an active club after that training. We had quite a few students from different schools reach out asking for clubs in their schools when we rolled out an allyship pledge banner in all the middle schools and high schools to include Tinian and Rhoda in 2019. And we had those banners filled. Kids were very happy to pledge their allyship. However, the barriers existed that there were no identified teacher advisors who were willing to take that club on in Southern Kagman and the other schools. There were different reasons. I reached out personally to some teachers and school counselors, and there are different reasons. Some of them I shared earlier in my testimony. That is one avenue. So when a child is exhibiting some struggles, mental health, social, emotional, or academic issues related to being a part of the community, one of their first lines is their school counselor. The school counselors are made aware of what are the community resources because they can be very specific. We're talking about concerns of suicide risk. School counselors are trained on how to do a risk assessment and referral to the ER as well as GLS or CGC. If there is assault issues, they're mandated reporters. So school counselors are frontline. Mental health PSS is just a new program, and within it, we embedded a curriculum for developing healthy relationships for our LGBTQIA specific curriculum to support the GSAs. But again, because of the pandemic, there were a limit of advisors willing to take the club on. Only MHS and Enroda were our active clubs, our champions. So that being said, when we open full-time face-to-face next school year, PSS has secured fundings to support a GSA for differentials for advisors with the incentive hopes that they take that on, but it's not a part of their duties and responsibilities. Oftentimes their teachers take on so many clubs as an additional hat and after-school activities.
Sorry, GSA, just so everybody knows, stands
Formerly
for...
Gay Straight Alliance Club or Gender Sexualities Alliance Club.
Okay, thank you.
So these are clubs. They're not a mandated curriculum. They're like after-school programs during lunch times where kids discuss missions and visions of reducing bullying or creating safe space posters in classrooms and gathering resources. So PSS Mental Health is also aligned in this next coming year on supporting the GSAs, the club student members, training on how to be as well lifeguards themselves on how to respond to a peer who's having mental health, substance use, or other type of crisis, how to navigate the words to say, the language, and the resources. So that's just up and coming. Yeah. Yeah.
Could I ask another question about training then? You mentioned there's a 6-hour training that that some of the schools have gone through, have completed. And I guess, well, one, I was wondering who's doing the training? Like what training resources are actually available for employers that would like to, you know, offer that to in their workplaces? It sounds like there may be a need for more training for medical professionals as well, law enforcement, in addition to that, and you know, I can imagine a need just even government-wide for LGBTQ issues to be part of employee training. And could you address that? And anybody on this panel, but it sounds like Dr. Jen, you've been most heavily involved in training, at least among the schools, right? So what are those resources?
I don't want to hog the mic. Remember in 2019, a mother didn't find a whole lot of resources and pulled together some online professional developments and tried to make it relevant, culturally appropriate, using the statistics. That's why I have them all already gathered. There's an online program called Safe Zone, and infamously, you had to make a donation to get that online training, but it is now free. And so what we've done is we modified that curriculum. You can get continuing education hours out of it, but we modified it and adapted it for the school base. Talks all about, when I was mentioning about sexual orientation, gender identity, it talks about how to support someone who's coming out, things to say, not to say, ways to connect them with resources and some of the issues being faced. So we developed it as a grassroots and just provided it for free. Anyone who wanted it. Like I said, Mark Carmel, NMC instructors, women's organizations, they took the leap of faith and saw a need. And you're right, at the proclamation this year, the governor acknowledged the need that all government agencies, it should be a required annual training. And I believe Kevin Bautista is tasked with developing that, and in partnership with PSS and how we've adapted and modified it. Be happy to be partners along with that. CHCC 3 years ago had a contractor with partner with PrEP out of PSS, as well as the maternal and childhood program had brought in somebody from Hawaii and did a training series for our CHC staff who were able to make the 2-day training, but recognizing that there was a need to have this annually as some of the language is updated. And Pride Mariana's, I believe this was 10 years ago, had provided a professional development for law enforcement. So there are little snippets here and there, but it's not a continuous, ongoing, or required type of training.
Thank you. That's it for my questions for now, and you can open it up to everybody else.
Do any of the other committee members have any questions or yes?
Thank you, Nava, and thank you for the panelists for being here. And I also want to extend my appreciation to the organizations that helped supported the Pride celebration on Rhoda as well. I believe that's the first time Rhoda has ever participated, and we saw a lot of participation from the community. So thank you again for extending your support. I just had one question for now, and it deals with is parents that identify as LGBTQ, and what support do we is there for students, maybe those who don't generally identify as LGBTQ but have parents that do, and so do we see a lot of those challenges with them being bullied or being questioned about their parents' choices, or and also do we see challenges with the parents in terms of raising a child in our community? Thank you.
I'll take that on. For support for parents, like I was mentioning earlier, was representation. It's a very powerful statement when you see the library this month also providing resources for parents and youth, making sure that our curriculum, whether we include in our history curriculum at the college level or high school level, that there's representation of historical figures within the LGBT community. In terms of specific support group parents, I haven't found one yet, except online or through Facebook. But there is an organization called PFLAG, which is a resource for parents to communicate, but that right now is online. But that's a way to connect. In given pandemic, we've gotten creative, but it is a need. There is a need for an opportunity for parents to connect who identify in the community or parents of children. So that might be still a similar group, but is a need. I forgot to mention that there are needs. There is a need for our resource center, an LGBTQI resource center. I don't know who's going to take that on, if it's a nonprofit or if it's an extension of the hospital or the coalition. That is a need. There is in Guam, there is a runaway shelter for youth who provide a safe haven for those who don't feel safe at home. So there are needs. I don't want to say that we're filling the gaps. I think it'd be important for agencies to identify what are resources available and what are some of the service gaps. That's where an additional needs assessment of agencies, I think, just to lay the cards on the table that we cannot handle everything. And sometimes we're going to have to tap into the supports of whether it's telehealth or other specialty services off island. to also support, certify advocates within the hospital setting on training of trainers on how we can also be empowered to develop that in the CNMI.
So in regards to same-sex parents, are there, I mean, can you share some of the challenges that same-sex parents faces in terms of whether it be healthcare or in education? Is that something that any of you would have information on?
I can say something about that. I think looking at the history of just the LGBTQ plus community, we can sort of deduce that there is an experience within that community that all of us or will similarly face. So, with in regards to parents, of course, individually they'll face that. Oh, you guys shouldn't be together because it's never like this. It's not traditional. It's not what is said in the Bible, which is sort of some of the things that they'll say to sort of strengthen their idea that they shouldn't be together. Um, as in regards to those parents being together, uh, I'm not. It's sort of, at least from what I've heard about, sort of it's sort of secondary for the parents. So, of course, usually students or kids face more interaction than parents because they're in schools. They're interacting with like large amounts of people in one day. So, just when these students enter these schools and these other students know that this one particular student has a have same sex parents or parents of the same gender, sort of the I guess bullying and the yeah, we'll just go with bullying that these kids will go through is that, oh, you must be gay too because your parents are same sex, or you must be lesbian too because your parents are both girls. And sort of, I say it's secondary because that is going through that kid and then it's going to that parent. So that's sort of some of the things that, or that's one of the things that a parent or same sex parents might experience in terms of bullying, harassment, oppression. So nothing comes to mind, but that's about it. Yeah.
I'd like to, oh, go ahead, Tara.
So, because we're from the CNMI and we have a very strong cultural tie to our culture, to our people, we're very fortunate here in the CNMI that the CNMI recognizes Boksai, which gives parents of the same sex, where normally one of them is biological and the other one isn't. It gives the same, almost the same rights to the person who is raising the child as if they were their biological. So because the CNMI recognizes Poksai, it allows for same-sex couples to bring up the child like it was their own.
I want to recognize my privilege as a cisgender female in a relationship. Just in my own setting in the past 3 years, I've been subjected to slurs. I've been subjected to being gaslighted. I've been subjected to being questioned about how I'm raising my child. And I've had some family and friends who are not willing to go with me on this journey. Other people had to walk on eggshells, wanting to support the cause, but not wanting to upset their stakeholders or their friends or other organizations that they're a part of, and that hurts. Some of the challenges, and I just want to give voice because nobody from that organization, there is a Facebook group in the CNMI who are not here today, and that question might be more appropriate for them. But some of the challenges for same-sex parents is, like we were mentioning, is some of the protections, whether they may face challenges with adoption, being questioned, acknowledgement of that non-traditional cohabitation. But these laws, again, don't exist according to our policies on some of the privileges and services that they may have access to. Stigma that they may raise a child who will eventually end up becoming LGBTQIA. There are still people in the US who call on parents for child abuse and neglect because people don't believe in their family system. So just wanted to share about that with just a little bit of support for parents. There is a need.
I'm communicating with Ms. Bonnie Pangolin on chatting, and so she just wanted to also add that in PSS, they've started looking at language in their policies, especially with sports chaperones and forms. They have had parents reach out from the elementary to advocate for their young LGBT students, but we don't yet have parent representation from that community. And so in a sense, this is also a call for any parents out there listening. If you are able or willing and able, we would love to have more representation in our PTAs, in our leadership for PSS to be another form of support to have representation in those areas. And so I just wanted to share with that. Thank you.
Thank you, and thank you. I yield for now. But
Yeah, and just to, I guess, follow up on that too, it's something that reminded me to ask, is there no PSS policy right now specific to bullying or harassment against LGBTQ youth? And is that in the works if there is no current policy?
I believe that there is just general anti-bullying policy, which is inclusive of anybody being bullied. But I don't recall if it's specific to any specific population, that it is, just that it is not acceptable. But maybe that's something that Bonnie will tell me more of when she's not talking about her grant.
That's a very good question. There was an anti-bullying policy that was passed. If you look at the Movement Advancement Project, it spells out the different ways that youth laws and policies, whether they have that specific language to identify whether using the slurs falls within the realm of bullying. So as according to this map, we are 1.5 out of 8 that exist in terms of policies within PSS. I've asked, and there is a current task group that is updating some of the policies to be more trauma informed, more mental health supportive, and updating within encompassing LGBTQIA policy.
If I could ask, oh, sorry, go ahead, Ripabata.
Good morning. Thank you so much for being here today. Thank you, Chairwoman, for setting this up. And Nava, thank you for organizing this roundtable. It's really been such a breath of fresh air to have this kind of discussion on the Hill with your leaders, direct, like face-to-face contact. So thank you so much for being brave enough to share your stories and share data with us. I am very grateful. My first question is in regards to what you'd like to see from your leaders, from us here on the Hill. If there's one way you'd like for us to respond, what would that be? Because there are so many ways that your leaders can respond. We can be more supportive of community events. We can host community events. We can do more of the discussions like this. I appreciate Dr. Jen's statement of being strategic because I also believe that's important. And so, where would you like us to start? If it is policies, what kind of policies? I am looking at the Movement Advancement Project. I was in communication with them during the pandemic. They do map out the statistics across our nation on how every state is doing in regards to policies, laws, and really advancing equality in the state. So, it covers everything from youth laws and policies, healthcare laws and policies, non-discrimination laws. We are not doing well on the score, as you all shared, right? And so, because this is a great start, because you do have leaders here now who are supportive, and because we are realistic about our 2-year term, what would you like to see from us? And maybe I'll just go ahead and start with Mr. Tumakani.
So in a school zone in particular, I feel like with enacting policies in the environments that we are in, we're still, as much as I hate to say it, we're still surrounded with teachers, we're still surrounded with people in the field who aren't accepting, and if they are, they'd say they tolerate us. And in finding a start, I feel like the best thing to do really now is just to educate. I did hear that there was a 6-hour professional development, and I feel like having more of those, having more time to educate those who maybe live their whole lives thinking this is wrong, we're supposed to fight against this, um, and that tolerance is enough, when really, if you are a professional, if you are an adult working in this field, you are also instrumental in a student's life. And what you do, what you say, your actions are relayed onto that student, and that student is going to pass on what they know to other people. So I feel like in beginning, there's really just a lot of education to do, um, not just to the students, but to the teachers as well, as what they say matters most to us. Going to school 5 days a week, looking to them when we need guidance. Um, it's really just a matter of starting where they don't know enough, I feel like.
Thank you, Mr. Tumakani. And I just want to point out that one of the great benefits of having a roundtable like this is that we do have the chairwoman of education here. I am vice chairwoman of that committee. I chair the Natural Resources Committee. We have our speaker here, and we have the chairman for Ways and Means, which is all things funding. So that's why roundtables are so important and so valuable, is because you have your leaders here who are here to listen. Yeah, Ms. Tyra, would you like to add to my first question about what would you like to see from us?
Sure. First of all, I want to thank you guys for having this group discussion, bringing everybody from the community. This means a lot to a lot of people who are suffering out there. And I do speak on behalf of the transgender community here because they are the most marginalized in the community. So when we ask what do we want to see from our leaders from this roundtable, we want to I think it's really important to know that right now, because of the lack of legislation that is inclusive, especially for non-conforming and transgender people, that we ask the first step would be for policy on non-discrimination laws to include sexual orientation and gender identity. Why? Because that affects so much of our lives. It affects public accommodation, housing, transportation. It affects healthcare, which is very, very important. There are people right now, as we sit here and talk, who fall between the cracks, and they have nowhere else to go to, and we can't, as we can't let them stay there. Another one would be accurate identity documents. Right now, there are people out there being harassed because their identity or their documents don't match their gender identity. And so that's super important. If we're really looking to make a change, these are little things that we can do to help people that are suffering out there. Another one are LGBTQ laws that help really help our youth give access to them, to mental health specialists, whether it be for substance abuse, for their gender identity, to cope with the trauma and abuse they get at home from their friends in schools. So, yeah, thank you.
Thank you. Anyone else would like to add?
It's a bit of a challenge because we're in the CNMI. We could also be given supports from exemplar states who have made mistakes and learned from them and could give us some guidance and wisdom. I think it's a little bit of a challenge for us to, as we're paving the way, to decide what is the most important thing at this law or specific policy at this point, because we're looking from the bottom of a negative tally of supports. It's what can you accomplish in 2 years? And just like we were mentioning, is there's just so much education and awareness. Right now at PSS, it's not a required PD. It's only based on a principal's request with the SSS program, and only 2 principals accessed that this past year. Granted, we were trying to reopen and close and then reopen, and so many things were happening, and so priorities kind of fall at the bottom of the barrel. But this coming next school year, it would be great if there was some support to see if that was something that was a mandate across all of the schools. Yeah, full support of a need for updated policies. You know, we have these trainings that go through and everyone says, yeah, we're going to update our forms. No problem. Easy. Just gender, male, female, transgender, other. It's not a big deal. That was 3 years ago and they're still not updated. And I'm still making my little box to include my child. So it's also the follow through. People will say things or they provide service or can do updates, but where is the follow through with that as well?
Thank you.
Yeah.
I appreciate all of your answers. And I wanted to just note Dr. Jen's recommendation that we conduct an anonymous survey. Can you share your experience with conducting surveys at the school level, the community level? What is the best way to start that? And any kind of guidance or advice would be appreciated.
So from my experience in conducting these surveys throughout the school year, what's really most important is respecting the anonymity of the person who is willing to open up and share these experiences. Because although what they seek most is a safe place where they can share their experiences, what's on their mind, what they're questioning, having their name there means a lot to them. Because in middle school and even in high school, a lot of these things that we feel we identify with are subject to change, which might be present on the data presented. A lot of the people that I work with, a lot of the people that I'm close with, often, or from what I've noticed, had a change of mind over time. And I'm afraid that with the survey results having no consistency, meaning to say if we were to have a survey this year and then conduct the next one maybe 5 years later, the results may change depending on the age demographic. Because as we live our lives, starting from a young age, where we begin to question these things, we only begin to learn more and more about ourselves, what's true and what's not true. So in conducting a survey, I do think the best thing to do is to respect the anonymity of the person, at the same time get the age demographic, and at the same time have it be consistent. Thank you.
T Project or PMY, did your organizations ever conduct an anonymous survey? And I guess second question, just following up on that, has data been shared among the organizations?
So we were working with National Center for Transgender Equality on a discrimination survey here in the CNMI, and how we were going to include the CNMI, Guam, and other territories. That didn't happen yet. We're hoping to meet with them sometime August or September to talk about how the execution would be. But what I did was to try and kind of see what kind of kinks we would run into with that kind of survey. I did it on a Google form, reached out to some of the community members that I knew personally, and just copied it exactly. And what I found out with that was there was a lot of error on doing online forms like that, and you couldn't really control who was taking the form or the survey. So a suggestion that was made to me for this was we could have, like, for every precinct, if we wanted to do an online survey, have like maybe 3 or 4 computers with us and have people come in and take the surveys on those computer. And that way we can control who takes it, give them their anonymity, and keep the integrity of the survey. Yeah, so that may be one.
Could I also ask,
Yeah.
though, Tyra, because I remember having a conversation with you also about partnering with CHCC to do something like the youth risk behavioral survey, but for adults and for the LGBTQ plus community. And could you just share with us like where that conversation has gone since then? Because I thought that there actually was somebody in vital statistics or epidemiology who was interested in moving that forward.
So I reached out with CHCC, met with Raina Soros, Emily Hanchinson, Sabrodo Banerjee, the COO, Kiana Villagomez, their educator, and we talked about some of the first steps. But one of the things that, one of the success stories that came out of that meeting was our HRT. And we found a doctor who was able to administer hormones to some of our transgender patients. I do have a meeting with the education for CHCC as a follow-up to that other meeting that we just had. This is on the 7th. And so it's in its early stages. We're trying to see, and I also have a meeting with Mr. Justin Andrew to see what how his office can help us on trying to get a survey done.
Justin Andrew, for everybody's information, is the Statistics
Yes.
Division Director at Department of Commerce. Yeah, and so isn't CHCC also getting ready to do like an update of the health and economic expenditures survey? Isn't that happening this year? I seem to recall Ms. Caitlin saying something about that.
Probably so. I'm not aware of that.
Okay, but
Yeah.
maybe this would be an opportunity to include LGBTQ, those questions in that survey. If they're already going to be going door to door and interviewing people and assuring anonymity, right? This will be the time
Yeah,
to do that.
I am aware of one behavioral health survey that's been combined with NCD. I'm not sure what the process is. It's the CNMI behavioral health survey.
Okay.
So that includes substance use, mental health, and this is for adult baseline data, adult data.
That might be exactly. The
Yeah,
last one was the
probably.
2016 survey, right?
Yes.
Okay.
Yeah,
Then
so that might
that
be
is
the
the same
one,
one.
yeah.
Okay. Thank you. I yield the floor if anybody else has any questions.
I like to suggest a couple of resources, anonymous surveys that have been developed stateside, comes up from the Human Rights Campaign. One is called Growing Up LGBT, and that's specific for youth. And so there's a series of 90-ish questions on identifying their youth experiences. I've suggested this to various stakeholders. Again, we're combating a lot of other surveys that are going out, and some of the comments are our staff or our teachers or our doctors are surveyed out. And so again, sometimes we just, whether there's a mass survey that goes out and all we had to do is include the LGBTQI voices so we can actually aggregate the data, it just doesn't get fit in on the final versions. Another one is a school climate survey through GLSEN, which is Gay, Lesbian, Straight Education Network, which also provides free resources on how for schools to support GSAs and clubs, resources for teachers. They've also developed a school climate survey. We're talking about different systems, right? We're looking at leadership. What are some of the barriers on providing certain services? What are some of the resources they need? Teachers, what is some of their resources and barriers? And then for students, what are your experiences? As well as our customer service surveys that could happen at the hospital level. How are your services? Did you receive gender affirming care? So there's quite a few surveys that have a potential for us to get a grasp on what we're dealing with in the community. But you're also kind of asking a bunch of volunteers what we're doing in terms of serving people out, when it could also be tasked with our government agencies. You have an opportunity when you meet to ask them with a soundbite about what type of opportunities they're updating their forums or gathering voices about our specific population.
Yeah, I've been, we're going through this budget process now, and I'm just thinking back to like what we did with the Universal Health Insurance Survey. So CHCC was actually directed in the Budget Act to do a feasibility study and present a report to the legislature. And I guess we can have that conversation further with CHCC, but that this upcoming Budget Act might be the opportunity to include that directive for CHCC or whatever the appropriate agency might be to collect that kind of data. I think that would be really helpful for the policymakers to have. Okay. And then I also just wanted to mention at this point, I mean, I'm also trying to be mindful of time, but if any of you have questions for us, I mean, this doesn't have to just be a one way. We ask you the questions. If you have anything you'd like to ask us, this is an open forum for that too.
A few months ago, when I found out that there was a committee meeting, and on the very bottom was LGBTQI issues, and we had two speakers who rallied up some resources. We just wanted to extend our appreciation that we were given beyond 3 minutes of that initial public forum and putting together Pride Talks for today. Still encourage you, as we are also busy in the front lines, gathering up things that we can do to help give voice, to not shy away from continued opportunities like this. So the questions that you asked were very good and very valid, and I know it's got a little bit of light bulb struck in us, and we will get back to the community and as best we can with things that we can do as our volunteer groups. But I would encourage you to do a follow-up, a part 2 of Pride Talks. Yeah. But no questions at this time. I just want to thank everyone for their support.
Thank you, Dr. Maritita. Does anyone else have any closing remarks or questions before we wrap up?
I have one final question, and I think there was some mention of the need for specialized mental health services for our LGBTQ community, and I think you mentioned telehealth, Dr. Jen, and we are looking right now at legislation that would add the CNMI to SIPACT, this compact of mental health providers who can provide telehealth services across jurisdictions for those that are members of this compact. And I just wanted to ask you or anybody here, like what are some considerations that we should be kind of keeping in our minds about making more telehealth services available, and particularly if there would be barriers for youth in need of specialized mental health services to be able to access telehealth from here.
Well, I think for starters, I think it's really working with the CHCC for policy issues regarding those. Just obtaining consent and even the platform that telehealth is going to be run on, ensuring confidentiality, HIPAA compliance, and things of that nature.
I'm in agreement. I've talked with some colleagues about PsycPact because in the CNMI since the pandemic, we've seen wait lists for services beyond what we've ever seen. We're very short-staffed and sometimes recruiting professionals, whether we even have FTEs open, don't get filled. So those are some of the challenges based in the private practice setting as well as in the hospital setting that I've talked with some colleagues. We've tried to extend bringing in some people from Guam. We got hit with barriers about needing licensure here, business license here. And so PsycPact would be an opportunity to connect with stateside services who are part of that agreement and telehealth services. I'm going to challenge a little bit about the need to empower the people here, because what we've seen, at least with the VA services, is when they provide telehealth services, whether it's through Hawaii, we have the time differences. We have sometimes some providers who are not provided with cultural competency type of training, so they're not familiar with some of the structures. And there we go. We have to educate the provider that is serving us, who has more questions than they can provide answers for ours. And so that's another challenge, is connecting with someone in Wisconsin who can't pronounce your ethnic identity correctly. So that's another challenge as well. That's the only barrier, but we're a lack of service. We are in desperate need of additional mental health services across the board, in addition to the specialty service. When, for example, somebody who wanted to get psychological assessment, is very specific, just like Tyra mentioned about the codes, is that it has to be an assessment specific for gender reassignment surgery. An example, I've asked providers on island, they don't provide that type of assessment. Asked in Guam, got referred to Hawaii. Hawaii doesn't acknowledge some of our local based healthcare, so that's out of pocket. So maybe PsycPact might be able to bridge some of that and help so that our local providers can provide other type of specialty services, whether it's support for like abuses or trauma and others versus the type of assessments needed for other type of care. Yep.
Thank you, everyone. Thank you to all of our guests for coming. Thank you to our panelists and our members of the MHS Pride Club for sharing comments with us today. Thank you for sharing your expertise, your experience. We really appreciate you taking the time to be here and help us understand the challenges that face the LGBTQ plus community and also some of the solutions that are taking place. And we do look forward to continuing to collaborate and have these kinds of conversations as time goes on, and hope that this is just the beginning of some very meaningful change here in the CNMI. So I will hand it over to our chair, Tina Sablon, just to give some closing remarks.
Thank you. And before I get to my closing statement, I wanted to just give a round of applause to Nava, who is actually completing her 3-month internship with the Health and Welfare and the Education Committees actually today. So this is her last day with us. This CNMI Pride Talks was her sort of grand finale project. She's been so instrumental in organizing today's roundtable, meeting with stakeholders, and then facilitating, of course, today. And so thank you, Nava. Nava has also been really helpful in assisting the Health and Welfare Committee in conducting public hearings, issuing and following up on requests for comments on legislation, preparing meeting minutes, policy briefs, and just keeping us generally organized and on top of things. So we do have a farewell and bon voyage cake for her. She's also just been such a pleasure to work with. And so thank you, Nava, for setting the bar and for all your hard work. And we wish you the best. She's going off to graduate school and her husband's going off to medical school. And so we hope that they will come back in maybe 10 years, she says, and to continue serving this community. And so on to my closing statement. On behalf of the Health and Welfare Committee, I want to thank everyone here for your invaluable contributions to today's CNMI Pride Talks. We appreciate your stories, your courage, your ideas, and for bringing your wisdom and insight to help guide the members of your legislature and also our community at large in just better understanding how we can create spaces that are more inclusive, that are braver and safer and more loving for everyone here. I think going forward, where we go from here, I think all of the members of this committee see this roundtable as an excellent start and the beginning of a thoughtful dialogue that should continue, and a community education process that definitely needs to continue. I've been thinking that there is also a need to, and I'd like to propose that we form a policy working group to prioritize some of the action items that have been discussed today and actually in previous meetings of this committee. A working group that would provide research-based analysis, assist in the drafting of legislation, looking at some of the examples from exemplar states and territories, and then looking at how we can adapt them appropriately here, and also strategize. Based on everything that I've read and heard thus far, I would like to see us focus on stronger non-discrimination protections in our laws, changes to government identification requirements, starting with Public Law 1550, and then improved access to healthcare and mental health care services in particular. And I'd like to see more legislative support for training, mandatory annual training that would be extended to our medical professionals, our government employees, our law enforcement, and our educators. And one last note on this working group is that it should go beyond a 2-year term, and it should transcend, the members of this committee, the members of any legislative term. I would suggest that it include legislators, and you have strong allies in this legislature, and I would be interested in offering my support and my participation for a policy working group, in this term and beyond. So I'd like to offer that. I propose that, and I would love to see this conversation continue and evolve into some realization of these action items that we've begun to talk about today. And so with that, I think this concludes our roundtable. I'd like to invite everybody to please grab some of our rainbow cupcakes. And there are other treats, other snacks, and some drinks on your way out. You're welcome to stay and chat. And thank you again for your participation. Happy Pride Month. Can we take a photo with everybody here?